All right, so hopefully you can all see my slides. As usual, this is for school and health department personnel. If you're someone else, we ask you drop off the call and we will post the slides and the recording on our website later this week or early next week. And make sure you pass along any information to others in your system that may need it. Some updates on testing. This says other testing info. I shifted around some order on my slides here. Sorry about that. We were just made aware today that we were told an update email from MDHHS was sent out to the superintendent through the Department of Education with an update about school testing. It said in it that due to supply constraints, the school test orders are just now starting to be shipped out and being shipped out based on school outbreak status and the dates in which their orders were placed. That some schools may receive or have already received a different test called the FlowFlex antigen over the counter, which is similar to Binax now. And in the email, there is a training video showing how to use that test. Also included in that email is a letter from Binax now stating that the FDA has approved an extension of their expiration date. So now the expiration date is 15 months from the production date. In the letter, it does list all the lot numbers with new expiration dates. But basically, if you go to the production date on the packaging, which is the bottom date, and go 15 months past that date, that is your new expiration date. The lot number is the number in between the two dates. So if you want to double check it on the letter that came with that email, you can do so. We've also been made aware that many of you have not received your backpack test kits that you ordered in December. That's mainly because it was such a popular program and they just don't have enough to supply everybody right now. We really don't have anything to do with these state testing initiatives. So we really can't do a whole lot to help you out with that. Just a reminder, if you have questions or concerns with any of these testing initiatives, the email is mdhhs-COVID testing support@michigan.gov. Also a reminder, if you go to michigan.gov/coronavirus, at the top, there'll be a tab that says resources, and then there's numerous things to choose from. If you pick the K through 12 school opening guidance, you'll come to this screen. The fourth tab down is team office hours. Mondays at 4:00 p.m. and Fridays 8:00 a.m. They do have office hours by Zoom. So if you have questions or concerns or anything about the testing program, they do have those twice a week standing office hours that you can connect in on through Zoom to get those questions answered. So just reminders on that. This initially was my first testing slide. Something you may want to pass on to your families and your teachers. You can order now to get 4 free at-home test kits through the federal government. I did order mine, and it said that they will start shipping at the end of January, which really is not that far away. So they're encouraging people to order them now so you have them when you need them. The site to go to is covidtests.gov. The direct link just to go to the order form is special.usps.com/testkits. And they recommend you test at home if you have symptoms 5 days after exposure or before you might be gathering with a high-risk group. The state has put together a nice one-pager to kind of help you with home testing and what to do after you've tested at home. And I put the link there for you. The other thing we learned was that they're going to be sending some at-home testing kits that are available on a first-come, first-served basis to libraries in some areas of the state and some of our counties. Clare County, Newaygo County, and Oceana County do have libraries that will be receiving some of those test kits. So I put those locations there so you know those spots as well. So hopefully we'll be having more and more tests available. Some other updates, the CDC is now adding in some preferential recommendations for masks. All masks are still acceptable. The biggest thing is still that they fit well. No matter what kind of mask you have, if it doesn't fit right, it's not going to work right. This image here is from the Michigan website. If you scroll down the main website, there's a tab that says Mask Up, Mask Right, and if you click that, you'll find this image. The direct link is here. But the CDC updates have just clarified that the concerns over shortages of N95s due to healthcare shortages are not really a concern anymore. You do want to avoid ones that say surgical N95s because those should be reserved for healthcare providers, and clarified that there are some times when more professional grade masks like respirators might be recommended. When you see the word respirator, they're speaking of an N95 or a KN95. So this is from the CDC website, just saying that respirators will have better filtration if they're worn properly at all times, so it can provide a bit of a higher level of protection than either a cloth mask or a surgical type mask. But again, if it's not worn properly, it's not going to work well if you take it off a lot. And you may want to consider a respirator or an N95, KN95 in certain situations where you may want better protection or need better protection, like if you're taking care of someone who's sick, you're at higher risk of severe illness. If you're in a job where you interact with a lot of people from the public, when you're riding buses or other public transportation, when you can't physically distance from people, you're in a crowded area, and if you're not up to date on your vaccines. Also saw in the news, I'm sure a lot of you did too, that free N95s will be provided to the public. There really is not a lot of detail yet as to how that's going to happen. I did see in one article mention of places like Target or Walgreens, places like that distributing them, but really we don't have any specifics on that yet. I know we've had a lot of schools with a lot of cases, and some have needed to take a pause in in-person education. I wanted to provide some information from the CDC with a little bit of commentary from things that I have witnessed, just to try to give guidance for those of you who are facing some of these situations. Obviously, our priority is to maintain in-person education as much as possible. But again, just some summary, really there is no specific threshold when you should go to remote or virtual learning. It relies on a lot of variability from school to school and with the situation. So I'm always happy to speak with you if you need help working through those situations, as are your county nurses or whoever you feel most comfortable talking with. But there have been many studies that have shown that the transmission within a school setting is at usually no worse than what it is in the community, and oftentimes less than in the community, especially when you have multiple layers of prevention in place. Ideally, having all prevention strategies in place are going to really keep your in-school transmission low, and again, lower than they might be in the community. And just as a reminder, I did put those different layers we're speaking of. So again, if you're seeing your case rates going up or you're seeing the community case rates going up, you may want to kind of go back to square one and start thinking about what can be added in, and make some messaging with families saying, if things get worse, rather than closing school, we're going to, go to masking for a few weeks or something like that, because my hope would be parents would rather do that than close school, but that's sometimes different than what we'd expect. So again, you may need to consider a variety of factors when you're deciding whether you need to go remote. Like, do you have enough teachers and staff to stay open and run school? Do you have an outbreak within the school? Like, do you know that the large number of cases are not just from the community, but that you actually have an ongoing outbreak within your school that you just can't control any other way? And are you unable to use certain prevention measures? Like, you can't keep up with contact tracing, you can't keep up with testing, you just have a really low vaccination rate, which you can't control. You can't get cooperation from families to mask, things like that. You just have no other choice. If you need to stop in-person education because of large numbers of cases and outbreaks, then any gathering of students should stop. So to stop in-person school, but to continue sports or extracurriculars really does not make any sense when you're trying to stop the spread of an illness. If you do need to close in-person school, messaging towards parents to really encourage keeping their kids home as much as possible, avoid gatherings, in order to stop the spread of illness is really important, or else, again, it just doesn't work. You're going to continue to have spread of illness. Encourage parents to keep getting kids tested for illness and to communicate with you what is happening, what illnesses they have, so that you can make the best decisions about returning back to in-person. This is right from the CDC. In-person learning should be prioritized over extracurricular activities and sports. So if you're seeing high levels of cases, consider stopping non-educational activities in the attempt to keep in-person school going. I know that's never a possible or a popular thing in most of our communities, but our goal of keeping in-person school open is the priority. But again, we know what sometimes our reality is. When you're seeing a lot of cases in the community or in the school, if you have the ability to start doing some screening testing or increasing screening testing, that may also help to keep illness out of the school. And again, if you're seeing more cases, you may do more to try to increase or add more preventative strategies, such as universal masking, maximizing your physical distancing, trying to improve ventilation, things like that. Obviously, again, we just kind of have to go back to square one. You might need to be prepared to switch to remote learning. And I know this is kind of a touchy subject, but you could always consider hybrid learning as an option. One I didn't mention is just if you do need to go remote, but you have students who don't learn well remote or don't have viable internet options, or if you do want to implement mandatory masking, but you have individuals who just will not agree to that. I did provide a link to the U.S. Department of Education where they do have some good reminders about providing hybrid and remote education. So, again, just kind of going back to those things that we had to think about a year and a half ago, just some good reminders, I guess. And then the question often is, how long do you need to stay closed? It depends on the illness. We are seeing other illnesses like influenza, strep throat, and other things. The ideal length is 2 incubation periods of whatever illness you're dealing with, but if you can at least stay closed for 1 incubation period, that's the ideal. So I did list all of that here for you. And then this was from a prior talk we had. The typical seasons that these different illnesses tend to be prevalent if you don't know what's happening, but many times you do have some idea, especially with the flu or COVID or strep throat. So this week we sent out, whether it was Monday or Tuesday, kind of depending on which health department had the Monday holiday off, we sent out some updated and new materials trying to help explain better the confusing information I discussed on Thursday. We also posted a lot of it onto our website. So this all would replace anything we sent out last week. And again, some of it is just new to try to help explain things. So this looks kind of busy, but one document was titled K-12 School Process. This was to try to explain or just kind of remind us of the flow of dealing with a positive case. We had talked that the individual case investigation, which really has not been happening to a large degree already, is more formally being shifted away from for the general public. The goal with the general public is still to notify them mainly through text messaging and provide them with education of what to do if they're positive, how to notify their own close contact on their own. Schools are still a high priority community to us, and we still will work to assist schools to the best of our ability. Most of your communities do have, many of your communities still have an HRA available. And so make sure and communicate with your local county about how you might still work together if you're unsure. But contact tracing and notification of families of close contacts is still expected of the schools, mainly because those kids can't really contact those close contacts on their own, if that makes sense. But this document again kind of goes through step by step. As an FYI, one thing on here is that those individuals are responsible for contacting their own out of school contacts. So you're only needing to think about the in-school contacts. If you become aware or concerned that someone in the school is a close contact to someone out of school, there are resources you can direct them toward, but you're not responsible for trying to manage illnesses, just like you're not really responsible for managing other illnesses. This last page has some really specific information of what to do in different scenarios, different exposures, different testing result scenarios. So it really breaks it down. Part of this does refer to using different letters, and then these letters were provided as Word documents so that you can edit them and use them as you wish. So one is a letter you can send to parents of kids that are positive, kids that are identified as close contacts. And if we ever get to a point where there are very few COVID cases, this is a general notification letter that you can send to a classroom or the entire school, if it's a rarity that there are cases. This is a letter you can use if you wish to notify your population, your families, just of the overall changes in quarantine and isolation guidance, but also just reminders of when to stay home and how long to stay home with different symptoms and other illnesses as well. I also provided that as just a separate PDF, just a document for parents and even for your staff, maybe taking phone calls and needing a reminder of how long kids need to stay out with different symptoms and illnesses. Again, there were a few changes. Later on Thursday, after we talked last time, the CDC made a change previously for kids in schools under 18. In order to not have to quarantine, they just needed their primary series. Well, last week, end of the week, like I said, they changed it to where they needed to be up to date on vaccines just like everybody else, which meant they had to have their booster as well. They, however, do state to allow time for students to catch up on the latest recommendations and minimize disruptions to in-person learning, schools may consider foregoing quarantine for students ages 12 to 17 who completed their primary vaccine series but have not yet received an eligible booster. Basically what that's saying is for those, and I already noticed the typo, I still says 2 doses of Pfizer here, and for some reason 2 doses of Moderna here. That should say 3 for both of those. But for those 12 and older, up to date is technically having 3 doses, so 2 primary and then the booster. But if you have a kiddo who's 14 who's been exposed and they've just had the 2 doses, it's perfectly okay to say, you know what, that's fine. You haven't had a chance to get your booster yet. You don't have to quarantine. If we're getting to a point where, you know, it's been 9 months and they haven't gotten a booster yet, that may be different. But for now, since really they've only had a month or 2 to get that booster, it is okay to give them some leeway. These are the flow sheets, some updates on this I had added here. If someone has symptoms and they test negative, or a healthcare provider gives them an alternate diagnosis, some instructions on when they can return back. I added in if the answers are no. To me, it was kind of self-explanatory, but we just wanted to make sure it was clear. On the second page, there was a missing arrow here. And then again, I changed it here where it used to say 18 and older, and to age 17, now it's to age 12 and older, because again, they've changed that recommendation. And then the last page had no changes. So again, I apologize. I know a lot of changes. Here, there's just some minimal changes. This was the longer text version of what those flow sheets show. I just, at the end of this document, has that detailed table, so I just make a comment there. This last document used to say that KN95s were not recommended in children. Now it says that child-size KN95s are recommended for children. And even that, the CDC is kind of wishy-washy on it because there's not a lot of research on those in kids, but if parents choose to use them, they can. They just should be the proper size. Again, I had forgotten to put in what happens if someone has symptoms and tests negative or got a different diagnosis, so I added that in there. Again, the definition of when a student does not need to quarantine was changed, so I made that change there. And then same with who should quarantine. And then I kind of broke out the option to test to stay a bit, and I broke out the household setting exposures and put it in a separate box just so it was a little more obvious, because I know that's a big question for a lot of people. And again, I added at the end of it this detailed table. It might be a good go-to for you to just go to that last page and check what to do there. So hopefully you should have all gotten that sent to you, whoever your point of contact is, and most of that is on our website. The letters are not, just because we don't really want parents to get a hold of, or whoever to get a hold of letters, because sometimes they're used inappropriately or get confusing. So your data can be found at the mystartmap.info. Going through the state information, sorry, I did not, the date was from the 18th. Our numbers are quite high. So the state average positivity is at 33%. The daily cases per million are at 1,600, and hospitalization rates, about 23% of our hospitalizations are for COVID positive individuals. They just did it a little differently here where they broke it out by region. The northern part of Michigan has a little bit lower case rate, but still, 900 to about 1,600 cases per million. So pretty high compared to where we've been in the past. As you can see, the 20 to 29-year-olds are around 2,500 cases per million. So our young adults are still the highest case rates. Hospitalization rates are still quite high. ICU rates are luckily lower, so illness is not quite as severe. Our childhood hospitalization rates are still the highest they've been, but still only at about 100 hospitalized kids in the state. Unfortunately, 2 children did die within the past couple of weeks, both in Kalamazoo. One child, the 9-year-old, did have a known immune compromising condition. Almost 89% of all the variant sequencing done in the last week were Omicron, and again, that's about a 2-week delay, so it's still pretty safe to assume it's pretty much all of it. This is really busy to see, but these are some predictions. This red dot is where we're at right now for cases, hospitalizations, and deaths. And the predictions being then for the majority of the different scenarios that they run through their little guessometer, have this really coming to a major decrease in March, but it looks as though we're hopefully on the downward trend of things. Hospitalizations and deaths, as usual, they tend to increase a bit after the case rate, but hopefully within the next 4 to 6 weeks, things should be really, hopefully, calm down, but we're hopefully hitting the peak of it now. So these are messages from MDHHS, from the state. So they did this week go over some of the case investigation and contact tracing information, really pointing out that of the over 360,000 cases that we've had since December, we've only gotten close contacts from about 4% of them, and of that 4% of close contacts, only a quarter of them were contacted from us. So really going to the point of why we're having such a hard time with all the hours we put into trying to investigate these cases, why the shift is happening to really contact them through different messaging, notify them of their case, and then provide them with education. They continue to stress, and this was in the materials we sent you, their resources now are going more to their hotline so that anyone who has questions can call and get information. Again, this is the state messaging. They mention that it does not, this shifting from the general public case investigation does not modify the school reporting requirements or the school's responsibility to notify exposed persons. So that was in their weekly report this week. They have updated materials for educating the public and have some others coming soon. Again, we've tried to provide that now. I know what I put together is not gorgeous, but it at least serves a purpose. So to find their updated materials, you would go to the michigan.gov/coronavirus. At the top here, if you click on contain COVID, you'll find materials on what to do if you're exposed, what to do if you're waiting for results, and what to do if you're positive. So that is what I have for today. Let me get to questions. If you have any questions, make sure and put them in the chat box. And afterwards, we will get to anyone on the phone. So first one is, has anyone begun notifying students or parents of a close contact via a letter or email? That amount of calls is overwhelming. So I don't know if that's a question for other schools on the line, if any other schools have started to notify people by letter or email or any way other than individual calls. We have one that said they're using a text alert system with success. And I know from the health department standpoint, that's how we're contacting our cases every day, is through a text system. I know not everyone has that technology, so it's not perfect. But I guess if anyone has been doing that, if you want to add comments to the chat or if you want to unmute and comment.
Dr. Morris, just a question about that. I like the idea of being able to use an alert system to reduce the number of calls. However, how are individuals navigating the choices that parents have in regards to test and return, mask and return, all of the variety of options available to them? How are they monitoring and keeping track of all of that? From a school setting, we then have to translate that information into classroom data that teachers can use to determine who should be masked and unmasked.
That's a good question. Does the Department of Education or anyone else help you guys with any of this? I'm guessing not. I guess that's where I struggle, is not being on the educational side of things. I mean, it's easy for me to give you recommendations, but I don't know how to actualize them for you. And I feel awful about that, but I don't know how to make this work for you in your setting. So I don't know, as we're trying to get this into a more routine situation, I don't know how we can make this work better, if there's even a way. I guess we can put that on the back burner, but I don't know if there's some way the department or somebody, or even just internally your RSDs or somebody can come together and share ideas, or I don't know. But I wish we could come up with more ideas for you. So according to the chart, did I screw up even more than I thought? So this was regarding my chart with the vaccinations. And I'm sorry, I probably was just sleep deprived and screwed it up. Oh, geez, oh, Pete. So yeah, I really screwed that one up, didn't I? So the visual, I'll fix the visual for the vaccines. I don't know how I screwed that up so badly. It should say greater than or equal to 5 months. And for some reason I copied and pasted the 2 weeks. Yeah, so I will fix that and we'll send it out with materials. I'm sorry. Geez, oh, Pete, that's pretty sad. So
that's okay. That question actually came from me, and because I have a 12-year-old, and so I actually looked on the Walmart website, because that's where he got it, and they're recommending 2 months later on their website.
Oh,
just
yeah,
FYI.
So that would only be for Johnson & Johnson. Yeah. So I think we're all trying to change things as quickly as the CDC does, and we can't keep up with our changes. So, but I will fix that. Yeah, I really messed that one up. So we'll fix it. Yeah. If we have 6 students we send home with symptoms, how long do you suggest they wait to test? Should we allow negative results from home tests, or should we tell them they need a PCR rapid test? So what is recommended, and it does explain it a bit more, but as soon as they're symptomatic, you should have them tested. The bigger concern comes if they're asymptomatic, like how soon after exposure could you trust a test? But the recommendation is a negative PCR test or a negative antigen test if they have a low likelihood of infection. So if that person has symptoms and has not been exposed to anybody, then you can trust that antigen test. If they have symptoms and their brother is positive, you would not trust, I mean, obviously you wouldn't trust that negative test. And that is in the table, that table I showed you, and also in the flow sheet where it explains what a negative test is. It's kind of up to you if you want to trust home tests. In my opinion, a home antigen test is the same as an antigen test that you would do at a clinic or at the school. It's just, are you going to want to see maybe a photo of it or something like that, or just take the family's word for it? Do you have concerns? You have families might lie to get their kids back in school. So if you don't have concerns like that, then you can just take their word for it. If you want to say we just need to see a picture of the test results, or put it in, just put it in a Ziploc and bring it in and show us, or whatever you feel comfortable with. But given the push to use home testing more and more, I think if we don't rely on those, it's going to be a mess. So again, if you have someone with symptoms and a negative antigen test, if they are at high risk for infection, like they're a close contact to somebody, then they should get a confirmatory PCR test, or there is an option to have them retest with an antigen test in a couple of days. If there are questions, again, you're not expected to be a healthcare provider. You can have them call their healthcare provider, or we can help you out with some of those decisions. It does not seem to matter if people are vaccinated at this point. Are you hearing anything about the CDC updating all guidelines to require quarantining for everyone again? No. So just adding in this extra little bit of quarantine for those who are not up to date on vaccines, that has been a change. Statistically, if you look big picture, being up to date on vaccines does still decrease your risk of infection. I know when you get people kind of clumped together in a group, sorry, I was getting text at the same time I was talking. If you get a bunch of people crammed together as a group, this is such a highly infectious variant, it sometimes can still overpower that vaccination, or just might seem like the vaccine isn't really helping. But we haven't really heard any word. The other thing, the reason why they shortened the time frames to begin with is just that with the amount of illness going on, to require everyone to quarantine would really put a screeching halt to our workforce. And so we're just there's a balance between preventing infection and still having a functional society. So there's just some comments in there about how other schools have used it. One school is saying they've used the Power School announcements to notify families of new protocols. Yeah, I know my kids' schools will often call home messages about general things rather than individual exposures. If we are using the state-issued tests, are we still required to report positive and negative? So COVID is still a reportable disease. So you are required to report any positive illness of COVID that you are aware of within 24 hours per public health code. If you are doing those tests, you are supposed to be reporting them to that website, that link on the website, and they are allowing for batch negative reporting. but yeah, you are supposed to be reporting positive cases. So I see a bunch of no's about that you're not supposed to be reporting positive. So I guess that's a question you'll need to take.
Hey Doc, I
to
think
the
those
state.
no's were in reaction to when you asked
Okay.
if MDE was helping. I don't think that the
Okay.
no's had anything to
Thank
do
you.
with the testing. Yep.
Okay, thanks. 'Cause like, oh gosh, not more confusion. Okay, so yes, keep reporting. There is a downloadable Excel document that you can fill in information and then upload it. And it may be easier to download that, fill in everything that stays the same week to week, fill in the new stuff, resave it as a new name, upload it, rather than trying to enter it in all the time. And then the response was that there was a text alert system called Swift K through K-12. So if anyone has any other questions and doesn't have access to their computer, if you want to unmute your phone or your computer and ask.
Hi, Dr. Morse. How you doing? Sean Petrie from Core ISD.
Yeah.
Thank you for your work on all this, and I know that I can feel your same questioning everything the same as we are. And but just a couple of things to hit with. Number one, we don't, as schools, get guidance as far as MDE or mandates. They kind of follow CDC, they follow health departments, and they say go back and talk to them, watch them, work with your local health departments. That's what we get for guidance. On the other side of it, with last week when we said, and this is a question, we only have to report our positive cases. So if I have a positive case in the school, I make sure that my local health department knows whom the person is, but I don't have to give the contact tracing list any longer. So that's the first question. Is that true still?
Correct. You don't have to give us the names of the contacts any longer. You just need to notify the parents that they're a close contact.
So what goes with that, now you should know, like in the schools, understanding as everybody, the overwhelmness right now of the contact tracing. And that's why the list keeps coming back to say, can we do it through text? Can we do it through phone calls? Because our staff, whether it be administrative or whomever's making the phone calls, if you're getting 4% reception of people, that's about what we're getting, but yet we're making 40 and 50 calls or more. So that's why a lot of them are saying we'll report the positives, and in-house we'll do our very, very best to not, to make sure we have a safe and sound environment, but to quarantine everybody. And like your other statement was, if we quarantine everybody, students and staff, we won't be having an educational process. We'll all be going remote again. So I get your feeling, and I don't mean to be acting like I'm griping, but I'm just saying that's kind of and then at that point, we get the letters and emails from parents on both sides of the fence on it. Yes, we don't get MDE guidance. So that's where I think the frustration level has hit. We appreciate your work and trying to help us. But and I'll go back to the M word, if there's no mandate, we have to do our best situation for each of our schools. And that's why you're seeing what you're seeing.
Yeah, no, and I completely get it. And I wish that I could make it better. And I don't know how else to do this. It's so frustrating for everybody. I don't know. I wish you were all given a better system to do this with and a more realistic expectation. I know that we're asked to give you guidance, and I don't know how to give you guidance that is actually livable. I just don't know. And we don't get a lot of other, I don't know how to say it in a way that won't get me in trouble, but.
Well, may I ask this?
I don't know.
I'm sorry to dominate the question, but
No, you're fine.
if you could kind of explain from last week's what is your vision to the school district, speaking to all of us, what is your vision for us for contact tracing? If we're not reporting it to you, but you're asking us to do it in-house, what does that vision look like from you as far as quarantining kids, notifying parents? What would it be as a health department, your comfort level, to kind of tell us if you were in charge of doing that? And I'm not being negative. How would you go about that? Because it's such a large magnitude.
Well, my vision is probably not a reality, but my vision would be that we'd have all of our preventative measures in place, so there wouldn't be as much concern of having close contacts in school. So if we could get masking in place, we wouldn't be as worried about close contacts being in school. And so we wouldn't be as worried about contact tracing from the get-go. The problem is that we just don't have that buy-in from a large percentage of our population. And so we have to have more concern. And I know testing is extremely time-consuming and difficult. And then the more you find cases, then you have more contact tracing to do. So I'm, as you could probably tell from my discussion last week where I felt like my head was going to explode, I just don't know what the answer is. And I don't know what the expectations are for the schools at this point. And that's where I feel like I'm making it worse for you guys by coming on these calls, because I feel like I'm just confusing things more.
No, I don't. Yeah, you're not, and they're appreciated, just so you know. But unfortunately, you're in the same boat that we are.
Yeah.
How about contact tracing? How would you go about that? Would you say that we're still looking at quarantining students, in your opinion, or do we say monitor for symptoms? If you have symptoms, return home, which is what we're really doing.
Well, I'm not supposed to say what isn't officially approved, but I know that when people have done test to stay, the positivity rate on those are maybe 1 to 2% of those who are exposed in the school. So, and my health officers can get mad at me if they want, but I would rather kids be in school. So as you're doing contact tracing, err on the side of keeping kids in school, is my opinion.
All right.
Because the odds of them getting sick from those in-school exposures is probably about 1%.
Thank you. I mean, overall, I just want to say the word thank you. I'm not trying to grill you. I appreciate your work.
I don't think you are. Yeah,
okay.
You're not. Yeah.
All right, I'll stop talking. I'll go on mute now.
No, you're fine. The biggest risk are those in-home exposures, and even when we were trying to talk to everybody, we never knew who they were, and they were still coming to school. So, it's that fine line of where we have to tell you what you're supposed to do, but in reality, you just have to do the best you can do. And I don't know how else I don't know how to functionalize that when we're given guidance that says one thing, but then reality is another. And my health officers that are on the phone can say something different if they'd like, but with the cases the way they are, if you did quarantine every close contact, you would not have school.
Thank you, Dr. Morse.
Yeah, Doc, this is Steve. I'll chime in here, and I appreciate everyone's frustration, and Doc is definitely doing the best she can. We all are. We all recognize that you are, and I would just say I echo her comments. I think the best thing that you can do at this point, however that system is, whether it's texting, whether it's emails, whether it's the form letters, if you can notify your contacts that they've had an exposure, they need to monitor for symptoms, especially if they would wear a mask. I kind of like Doc said, keep them in school and monitor for symptoms. If they have symptoms, that's when you got to send them home.
Doc, this is Liz with Mid-Michigan. I support what you're saying also, and keep them in school is always been the plan. Thank you.
I think not coming to school when you're sick and not sending kids to school that you know have COVID are biggies and things that I've heard happening. And so, if you keep people out that you know are sick and contagious, I think those are the biggies. So, but just know that I'm supposed to tell you all this other stuff, and you're supposed to try to do it the best you can, and then, let reality fill in the blanks. Any other questions?
Dr. Morse, this is Sarah. There's a couple new questions in the chat.
Oh, yeah. I saw some comments about, okay, can we just report the number of positive cases to the health department instead of detailed into each case? So if it's regarding the testing you're doing from the state testing initiative, you need to ask them because they have continued to need those cases reported through that platform. Otherwise, contact your county nurse or whoever it is you've been reporting to and see what the best way is, or if there's some better way you might be able to report those things in an easier way. I think the others are, do we use the health department? This is about notifying people. Just using the letter and modifying things. So again, reporting, working on individual situations, all of that does vary a bit from health department and county to county. So if you have questions or concerns how to do that, you should all have a point of contact you've been working with or potentially an HRA. So make sure to reach out to them and see if there are any specifics or ways that things might be modified or changed to make it easier. Sarah, did you have another thing?
I just wanted to comment on the question about not reporting through the state portal. The last call that I was on with the state, if the schools aren't using that portal, it will impact their ability to order a new tests in the future. So if they're not seeing that you're using them, you're not going to get more tests. That's my understanding of the last call I was on.
Yeah, and that I did see that on a prior presentation and memos that went out that they'll resend tests to you and you've used, I think, 80% of what you have, and the only way they know what you've used is what you've reported on, if that sounds right. So if you're not getting tests and wonder why, it's likely, it could be because they don't know that you need them. So anyway, I know we're getting close to an hour. Any other questions? All right, guys, I will once again, I'll fix that graphic on up to date on vaccines, and it looks like the state's working on one too that'll probably look a lot better. If you have any questions or concerns in the meantime, you know how to reach us, and we'll talk next week. Hang in there, and hopefully we're on the down slope.